Osterholm, in his op-ed, recalled a 2012 Canadian study where pigs that were infected with the Ebola virus passed the disease to monkeys caged nearby. The animals had no contact with each other, proving, allegedly, that the virus could be spread by the respiratory route.
Health officials in the Democratic Republic of Congo say 2 more people have died from the Ebola virus. Spokesperson for the Health Ministry, Jessica Ilunga, says the fatalities were recorded in the northeast city of Mbandaka, and a nurse died in the village of Bikoro, where the outbreak was first detected. Officials have also confirmed 7 new cases. Health workers began an immunization campaign yesterday in an attempt to halt the spread of the virus. At least 28 people are now believed to have died in the current outbreak.
As of today, Ministry of Health of Democratic Republic of Congo reported 51 cases. Out of those 51, 28 are confirmed with the lab, 21 are considered probable, and there are 2 suspect cases. The number of deaths is 27. So the vaccination started yesterday in Mbandaka. 33 people received vaccine yesterday. They were health workers, but also a few people in 2 areas in a community in Mbandaka. We will continue to do vaccination today. In Bikoro, our colleagues from MSF will be involved in vaccination. Hopefully this will start later in a week or the next week once the preparations are done. Getting in vaccines, getting in freezers, having enough of fuel so these freezers can function in the area where you don't really have electricity. You need to have vaccination teams to be trained so they know exactly what they need to do, how to get a consent, how to define eligibility of a contact and contacts of contacts.
Leading by example, the man in charge of the World Health Organization's immunization program is the first to receive the experimental Ebola vaccine in the Democratic Republic of Congo.
When people are exposed to Ebola, they must be vaccinated. This vaccine is an integral part of the prevention program, so that we can stop the disease from spreading.
The WHO has flown in more than 4,000 doses to the city of Mbandaka. That's where the first urban cases of the disease were reported last week. Frontline health workers are the first to be immunized.
We're very happy to get the vaccine since Ebola is a disease that's very difficult to treat and is often fatal. So we're lucky, and as health workers, we hope it will protect us.
The vaccine has not yet been approved by health regulators, but it was effective in limited trials during the Ebola outbreak in West Africa between 2014 and 2016.
If we manage to cut the transmission line, it will benefit the international scientific community, because we will have shown that the vaccine works in Guinea and Sierra Leone, and it works here as well. I think we will have enough elements to provide a weapon against this epidemic, which is, frankly, very, very serious.
Government ministers are also encouraging people to wash their hands, limit physical contact, and above all, be vigilant.
Vaccinations can only be effective if all other preventative measures are followed, starting with surveillance in the household. This will not be a mass vaccination program. It will be targeted at health professionals and then anyone who's been in contact with a patient who's had symptoms of Ebola.
The WHO says more doses of the vaccine are on the way. One challenge will be keeping them cold in this vast, impoverished and tropical country. Victoria Gatenby, Al Jazeera.
15 years ago, he died. He was a respected epidemiologist.
As you know, the IHR Emergency Committee met on Friday and advised me not to declare a public health emergency of international concern, although they noted that the situation remains very serious. I have accepted that advice. It's concerning that we now have cases of Ebola in an urban center, but we're much better placed to deal with this outbreak than we were in 2014. I am pleased to say that vaccination is starting as we speak today. Unfortunately, the health minister of the Democratic Republic of Congo cannot be with us today, but I hope he will be able to join us tomorrow because he is being involved in the vaccination effort. The outbreak in Bikoro illustrates again the health security and universal health coverage are two sides of the same coin. The best thing we can do to prevent future outbreaks is to strengthen health systems everywhere.
Coming up on Network Africa, the World Health Organization raises its assessment risk of Ebola outbreak in the DRC from high to very high. The World Health Organization has raised its assessment of the risk to public health from the Ebola outbreak in the Democratic Republic of Congo from high to very high at the national level. 11 more people are confirmed to have contracted the disease and 25 people in total are now thought to have died. The WHO is to hold an emergency meeting today to consider the international risk of the outbreak. Meanwhile, Sierra Leone's military held a 2-day simulation exercise in Freetown to test the armed forces' preparedness in case of an Ebola outbreak. The medical unit of the Republic of Sierra Leone Armed Forces set up what they call a rapid deployable isolation and treatment facility at Wilberforce Barracks in the capital. Sierra Leone is holding emergency Ebola drills to test the preparedness for an outbreak. The country experienced the last outbreak in 2014 to 2016 that killed more than 11,000 people in West Africa.
In the context of an epidemic, some of the things that have been associated with transmission are the need to care for a sick person, and when a person is suspected to have Ebola, they need to be taken to an Ebola treatment unit so that they can be safely taken care of rather than being taken care of at home. Secondly, when there are fatalities during an Ebola epidemic, safe burial practices are essential. General hand washing of the population in the midst of an epidemic. In a situation like now, when there is no active Ebola, no special precautions need to be taken. And this field training exercise is not for anything going on at the present time, but in case there might be an epidemic sometime in the future.
We have been doing classroom work with our nurses and doctors, and this is like a simulation to see how we receive a patient. If a patient comes with Ebola, how we administer the drug and how we take care of the patient. So it's just like part of our normal routine training. It has nothing to do with DRC, but as we know, Ebola is an infectious disease and we must maintain our readiness.
Hey everybody, Brad with Full Spectrum Survival. Ebola is spreading in the DRC right now. It has a 56% kill ratio. 56% of the people that contract the disease are dying from it. Ebola is one of the most dangerous viruses on in the open world right now. People bleed out their eyes, bleed out their internal organs. Hemorrhagic fever is what it's called in the medical world. You're basically bleeding out from the inside. 56% of the people. 2 people get it, 1 of them dies. 1 person gets it, they flip a coin, see if they survive or not. Now, I want to talk today about cognitive dissonance. I want to talk about why we're hearing so much about it. And I want to talk about the vaccine push. The first thing I want to say is cognitive dissonance. A lot of people are going to say Ebola's fake. It's not. A lot of people are going to say it's man-made. That, of course, could be. There's no way anybody can rule that out. And they're going to say it's a reason for them to push a vaccine, and that's why it was let out into the world. Again, that could be. There's no way that anybody can rule that out. The fact is, Ebola right now is spreading in a place where there's a population of 1 million people. When we saw Ebola spread the last 2 years, it was in little rural areas. Little areas where it took a lot for somebody to get from one location to another where they could spread it. Not this time. This is why it triggered one of our alerts, because it's in a place that has a propensity to cause it to spread exponentially. The World Health Organization came out yesterday and they said the international spread level is high. That means if it hasn't already, it likely will spread internationally across borders. The global threat is still moderate. That means even though it's going to spread from the DRC, there's still a chance to contain it beyond that point. The World Health Organization, along with other nonprofit organizations, some religious organizations, are sending men and women into the zone to actively quarantine the areas. They've stocked up the borders with infrared thermometers so that they can stop people at a safer distance, see what their temperature readings are. They can keep a log of who's coming and going and where they're going. The threat here is also that it's in a society that has a general distrust of Western medicine, which I can't say is unfounded. This society has a general distrust of Western people, which again I can't say is unfounded. So what happens is these people who are affected with this disease lie. They don't tell the exact truths. They say they're not symptomatic. Oh, they've just got a cold. Just sniffling. They just ran up here. That's why their body temperature is hotter. And they get passed through the borders into these other areas. Or once they move beyond, they're lost because they didn't give correct information. This is one of the protocols that these organizations are trying to lock down. Now, a lot of people are also going to say the vaccine, that's why it's being pushed. That's why we're hearing about it. It doesn't matter. 1 out of 2 people who get it are dying. So whether they're doing it to push a vaccine or not, that doesn't change this fact over here. The fact is, if it spreads globally, 56% of the people who contract this disease are going to die from it. Now, the vaccine is experimental. I've read the reports. There's a lot of primary and secondary negative reactions to it. If you're witnessing your family dying from the disease, I bet a lot of people are going to take it. What does this mean for our community? Once it jumps the international border, if it were to go global, the disease researchers, the virologists of the world, their biggest concern is that it will reach a point where it can no longer be contained. We're near that. Perspective. Ebola is transferred by fluid. So you say, okay, well, I just stay away from everybody. And that'll work. But think about stomach virus. Think about the stomach flu. Also transferred by fluid. How many people do you know that have gotten the stomach flu over the years? It's not unheard of for it to overwhelm an entire cruise ship, as an example. What if someone with Ebola got onto a cruise ship? It's not unheard of for it to overwhelm school systems, cafeterias, restaurants, where fluids are transferred a little bit more easily, a little bit easier. The fact that there's 1 million people in the city where it's spreading right now has disease researchers very concerned, and honestly, it has us concerned. It's definitely elevated itself on one of the major concerns that we're looking at. North Korea, okay, we know there's him-ha there. Syria and Russia and the U.S. proxy war there, definitely a cause for concern. Probably nothing's going to happen tonight. Ebola, on the other hand, is spreading beyond, there's mosquitoes everywhere. It's spreading beyond the organization's ability to see it. The vaccine has to be kept in a cold chain at negative 60 degrees when in use. That has a lot of room for error. Now, what's the U.S. danger? What's the Western danger? If it gets into the United States, be prepared to lock yourself down. Make sure that you have all these preparations, all these plans as a preparedness-minded person, as a homesteader. You should have your 30 days of food. You should have your extra months of medicine. You should have your plans in order to call into work and say, I had a family emergency. Trust me, Ebola spreading is a family emergency. Have these plans ready. If it gets here and you see it starting to spread, lock it down. Now, some people are going to say that's extremism. That's an extreme point of view. That's never going to happen. False. It is going to happen. It's not a matter of if. It is a matter of when. A pandemic virus, a biological threat, a chemical weapon, something will spread beyond humankind's ability to contain it. Might not be Ebola, might not be this year. Something will. So if you're not prepared to handle it, you will be on the downside of that trend. That's somewhere where I don't want you to be, where I don't want me and my family to be. Please take this moment, look at Ebola, look at what is happening there, view the graphic images of what's going on there, and say, what can I do not to let that happen to me? Guys, I hope this raised your awareness a little bit on the spread of Ebola, just to put it into perspective that it's in a city where it's spreadable now, whereas before it was in small villages and didn't have much, they were able to lock it down with the military real quick. 1 million people with the DRC's military is an entirely different story. Will they lock it down with the military if it spreads to the West? If it spreads to the U.S.? Will they quarantine cities, airports, an entire region? Absolutely. Are you prepared for that? From Kelly and I to you and yours, I hope that you will stay safe and keep watch.